In this video, we are going to discuss the in-depth interviews and the standard checklists that are used as methods of data collection in the health and medical research. We start with the interviews, and according to Moniti and Ital in 1986, an interview involved an interviewer reading questions to the respondents, and then the respondents will answer these questions, and then there will be recording of the answers. And according to Burns, an interview is a verbal interview, and often face to face. So the telephone calls also may be used for interviews, in which an interviewer tries to generate information, beliefs, opinions, concepts, experiences from another person, from the participant who is involved in the research. We can talk about in-depth interviews, and these are directed conversations between equals where the interviewer, not an interview schedule, is the research tool. In other words, not only learning the answer to the questions that are raised in the interview, but also learning how to formulate questions. What sort of questions are there to ask? You will learn how to formulate questions, how to formulate questions based on the interviewer's responses, so that you can generate important information for the research. Widely used in qualitative research and studies, the interviewer must encourage the respondent to discuss thoroughly the issues of concern, of importance to the research topic, so that he or she will be able to generate important information which is credible and useful for the research itself. The question format is the dichotomous questions are to be avoided interviews. In other words, we cannot use dichotomous questions in the sense that is this is right, if this is wrong, and so on. But we have to formulate questions such as how, why, what, to what extent, and the language should be at the level of the respondent, so that it can this can facilitate the communication between the interviewer and the interviewee, and the language should be simple and easily understood by the respondents. I mean, it's better to avoid difficult terms, technical terms, or medical terms that will not be easily understood by the interviewee. We can use common sense when probing for more details, about the question, especially that the interviewer is expected to formulate questions based on the responses of the interviewee. So also it's important to allow the respondent to ask questions, so that anything that cannot be easily understood or is not clear can be explained, and this will facilitate for the respondent to generate more information that might be useful for the research. And also, we try always to be non-judgmental in the responses which are raised by the interviewee, so that if you become judgmental, then this will affect the communication between you and the interviewee. And also, we can use deep records for recording the conversation, so that you can refer to it. And if possible, the interviewer can record the interview, or otherwise notes are taken during the interview, so that you can refer to it later when transcripting the details of the interviews. The time of the interview we can think of about the time of 1 hour. If that should be quite enough to ask most of the question. And if we consider that the working hours per day are about 8 hours, then only 2 to 3 interviews can be scheduled and implemented during the 8 hours. And the remaining time, we should be spent in transcription of the interviews and the details of the information obtained through the interviews. The other thing is that we need to emphasize here is that continuous revision of the interview's transcript is important, and this will help to continuously read the interview's transcript so that the interviewer can develop new questions or new ways of asking the questions, or for even formulation of new questions that are important based on the responses that have been generated from the interviews already conducted. The advantage is that the interview is potential for very rich information in the words of the respondent. So that in 1 hour, if you ask 10 or 15 questions, then you can generate rich information from the interview. And also it facilitates, and it is important to approach or to broach sensitive issues. This is in contrary, if we compare it to the focus group discussion is inappropriate if the topic for the discussion is sensitive. But here, in interviews, you can easily, the interviewer will be able to approach or to broach sensitive issues, like, for example, sexual behavior or any other issues, similar issues. The advantage of the interviews that are flexible, so that you can reformulate the questions, you can adjust the question, and based on the responses that had been raised, or even based on the question of clarification raised by the interviewee. Also, there is possibility of easily combining the in-depth interview with other data collection methods, such as quantitative methods, clinical examination, or on-site observation, or so on. Disadvantage is that the interview is time-consuming and therefore increase the cost of the research. And data are not easy to code analyze, you see, so that if you want to analyze the data, that needs much effort. Although now we have newly recent softwares that can help in the analysis of qualitative data, like the interviews or focus group discussion. For example, the QDA, Qualitative Data Analysis 2020. That is very important software that is helpful for the researcher to conduct appropriate analysis for the qualitative data, such as interviews data and focus data generated from focus group discussion, and so on and so forth. The other disadvantage is that interview relies solely on verbal statements by the interviewee, and which could be very subjective and biased. Also, people say and do different things in different situations, and the comparability of the results of the interviews is not always possible, because there are always variation in the responses of the interviews and so on, interviewees, and this will make it very difficult to make some sort of comparison about the result of the interviews. Also, we can talk about the key informant interviews, which is another variety of interviews. And this is informal conversational interviews, and the informants being interviewed respond in their own words to express personal views and opinions and their experience. And now we can ask, who are the key informant? And this is very important for us. We can ask about the key informant. A key informant is the person who is especially knowledgeable, at least in some subjects or topics of interest, and with whom the interviewer develops an ongoing relationship of information exchange and discussion during the interview. And most people act as informants without realizing that they are informants, especially when they offer information in response to questions about their everyday lives. And this is general informant, as we come to see. So we need to differentiate between a general informant and the key informant. General informants primarily give information about themselves, about their own experiences, about their own expertise, whereas key informants provide informations about others, about specific situations, about important issues, about certain problems, about events, about conditions in the study area. So this is the difference between the general informants and the key informants. And thus a key informant is a kind of expert on some cultural or political or social or health aspect of the community beyond his or her own personal beliefs and behaviors. The strengths of the key informant interview, they can be conducted by trained interviewers with relative ease, and also they can be conducted during all phases of the study in combination with other method data collection such as a questionnaire or standard checklist or so. They are relatively inexpensive and cheap to conduct, and the weakness is that they do not measure frequency of the issue or event under the study, and they do not observe actual behavior because people say something and may be behaving differently. And the informant or interviewer relationship can be easily confused with other relations. And then we can talk about the observations checklist. And observation is the process of collecting data about the information directly by observing people and their places, maybe in the delivery room or in the outpatient department. You make some sort of observation for the behavior of the healthcare provider towards the patients, how they interview them, how they counsel them, and so on. In addition, according to Cambridge Dictionary, observation is to watch carefully the way something happens or the way someone doing something. Maybe somebody who is, for example, a healthcare provider is counseling an HIV patient or a lady for family planning. So you observe how the behavior is going on and how the communication is between, for example, the patient and the healthcare provider, especially in order to learn more about such behavior. Thus, observation is one of the techniques to observe and found how directly and indirectly the activity happens on the subject of the study. And this involves a person who observe the events, or who, for example, we can use also the standard checklist to check for the availability of certain drugs or equipments or instruments, and whether, for example, these instruments are functioning or not functioning. And also we observe people during their work. For example, you can observe a midwifery cadre who is attending a delivery in the delivery room, and also interactions around the topic to provide rich description of such situations and individuals. Um, that is the end of it. Thank you very much.